Doctor, in the case of osteoarthritis in the knee, most allopathic doctors suggest surgery as the only option. So how is it that you are able to deliver a significant improvement without even having to undergo surgery? What is the difference here, and how does it exactly work?
Yeah. See, the basic thing is modern medicine has been working for a long time on degeneration, but unfortunately there is no holistic concept of how to prevent degeneration. In modern medicine, primarily we have good medicines to bring down inflammation. There are good medicines to relieve pain. There are many other issues have been well processed in Ayurveda. They come out with good medicines, but unfortunately for many of the degenerative conditions, modern medicine has not really come out with good solutions. I think that is one of the big areas where Ayurveda can play a very significant role, and that's one of the areas where Ayurveda is playing a big role. Especially at AVN, we find that the degenerative diseases are one of our strongest areas.
Okay.
And because Ayurveda has a very strong concept surrounding how to prevent degeneration. It is inevitable because aging is a natural process, and tissues and organs in the body degenerate with age.
Yeah.
But what we are talking about is premature degeneration. See, earlier the diseases like cervical spondylosis or any sort of degenerative skeletal-muscular was considered a disease of old age, whereas today we see that even at a very young age.
Yeah.
So it's largely due to several factors playing a role, including their own genetics. So detecting the propensity to get the disease onwards, Ayurveda can play a role. Okay. We say that a person with a Vata constitution is prone to degeneration of the joint. So right from his childhood, you could do certain things to prevent this thing from happening.
Okay.
So that's what I'm talking, that is more from the preventive aspect. So in short, what I'm trying to say is that Ayurveda has a more holistic understanding of degeneration as a process, and it has got a very well-defined protocol on how you can approach and treat degenerative diseases. So that is what we leverage very strongly in AVN here. So we use the degeneration, we use the anti-degenerative treatment very well after doing the detoxification, which is what is recommended in Ayurveda.
Okay.
And you cannot prevent degeneration if you are full of toxins. So you need to sort of detoxify the body and then give them rejuvenative herbs. There is a whole specialty in Ayurveda called Rasayana, which is around how do you preserve the tissues of the body and prevent them from aging.
Okay.
How do you slow down the aging? We cannot completely stop aging, but how do you slow down aging? So there are very specific herbs and herbal therapies as well as herbal products which can help in preventing the degeneration. So we have also as an organization specialized on that anti-degenerative aspect, and that is what is enabling us to sort of provide the treatment which has got lasting effects even in patients who have been told that only surgery is an option. There are several patients, almost a big chunk of our patients coming to us for osteoarthritis come with very advanced stages and where they have been told that surgery is the only option and they don't want it. So that is one of the big things that we do.
Okay.
So we have a multidisciplinary approach in the way we treat these conditions. We have a physiatrist who also supports our rehabilitation services, and we use yoga because there is a lot of psychosomatic overlay as well. Stress creates tension in the muscles, which can also increase stiffness and cause muscle pain. So there are several components which go into the symptom manifestation and the functional disability that the patient suffers from. So we try to approach all the different areas, and as a net result the patient feels an overwhelming response. Whereas the joint per se, the cartilage that is worn out, we don't claim to be able to completely regenerate the cartilage with just one course of treatment. But functionally they improve dramatically, that the patient who is not able to walk even few steps is now able to walk a kilometer after some time, When we also give them exercises which they can do even after they go back home, we give them these anti-degenerative medicines as well.
Okay.
So that's a big chunk of the patients that we treat. Yeah.
So can surgery be avoided in such cases where it has been recommended?
Yeah, in fact in most of the cases, I would say a large portion, about 90-95% of the patients, we are able to avoid surgery.
Okay.
But in very advanced cases, we also tell them that it may be good for you to undergo surgery. Because if the joint is completely worn out and the age is also advanced, it is probably a very good idea to undergo surgery, because an artificial joint can last from about 10-12 years up to maximum of 15 years. A good high value joint, with good material, can last up to about 12 to 15 years, but that's all it can last. So if a patient at the age of 45 or 50 is to undergo a replacement surgery, he's going to have it reoperated. So which is a disaster. Nobody wants to even undergo one surgery, leave alone having to have it done twice. So in all those cases where they are young, we try and do a very intense intervention and we are able to prevent them from going for a very premature surgery. But whereas if they are in advanced stage and probably one joint replacement could last them through their lifetime, then we say, and if the joint is really so bad that it is affecting their quality of life and we don't think it's possible for us to bring them back to a functional state of living, we tell them that it's good for you to undergo a replacement as well. It's not that we are ruling out or completely against a replacement, but there are also options available. We definitely want to present our treatment as an option to patients who want to avoid surgery, and most of them are able to live good functional lives without having to undergo surgery.